Good morning. The first item of business is general questions. Question number 1 has been withdrawn. At question number 2, I call Faisal Chowdhury.
Thank you, Presiding Officer. To ask the Scottish Government what safeguarding training NHS Board are required to provide to non-clinical staff who are handling interaction with members of the public.
Cabinet Secretary Michael Matheson.
The staff governance standards, which is applicable to all staff employed by NHS Scotland, requires health boards to appropriately train and develop staff and provide a safe working environment. The national policies on personal development and managing health at work supports boards as employers of NHS staff and to identify and provide necessary training for staff according to statutory requirements, the job role and individual training needs.
Faisal Chowdhury.
Thank the Cabinet Secretary for the answer. People who require to use NHS service will go through a process of dealing with non-clinical staff before seeing a medical professional. Many of these patients may be neurodivergent or require tailored communication. It is important that staff can identify needs and transmit the medical information in a way that is effective and appropriate for the neurodivergent patients. Can I ask the Scottish Government how often it monitors and reviews the type of safeguarding training required for non-clinical staff with regard to these specific needs?
Cabinet Secretary.
Well, Presiding Officer, the national policy is to ensure that NHS staff, in whichever role they are working, that they are provided with the appropriate training to undertake that role. It's then the responsibility of their employer, the NHS Board, to ensure that they are receiving the necessary training. Therefore, those non-clinical staff that are working with individuals who have neurodivergent conditions, that they should be appropriately trained in order to do so. However, if the member has some specific examples where he feels that has not been the case, if he wants to write to me with the details of that, I'm more than happy to look into the issue for him and to ensure the issue has been appropriately addressed.
Question number 3 has been withdrawn. Question number 4 is not lodged. Question number 5, I call Martin Whitfield.
I'm very grateful, Presiding Officer. To ask the Scottish Government what steps it's taking to improve lifelong learning in Scotland.
Minister Graham Day.
Presiding Officer, our lifelong learning offer already caters for a range of learner needs. However, last month I set out to Parliament the steps that I will be taking to further improve lifelong learning in Scotland. As part of our reform programme, the Scottish Government will take the lead on skills planning, simplifying funding and take a central role in the development of apprenticeships. I have also commissioned a short independent review of community learning to be led by Kate Still, with recommendations to be made by summer 2024.
Martin Whitfield.
I'm very grateful for that response, and I hope we can agree across the whole of this chamber the importance of lifelong learning. Last year, in its Adult Lifetime Skills, a literature review, there was a quote that literature on the weakness of the current adult skills system in Scotland is also relatively sparse. So after 25 years of being a devolved nation, with the SNP government in charge for 17 years, in the light of this, can the Minister tell us why there are still significant gaps in lifetime skills data, and what the government is going to rectify, when the government is going to rectify this, and when is it going to be identified, and more importantly, the need met?
Minister.
Officer, let me begin with a note of consensus. I completely concur with Martin Whitfield on the importance of this, and I also recognise that he has a genuine interest in all this topic. So let me offer just 3 specifics around what we are planning to do, because I think it's more important what we are intending to do and what we will do rather than what's happened previously. And I hope this provides them with some reassurance on the seriousness of my intent in this area. The National Career Service that we'll be offering, we intend, will be an all-age service, not aimed primarily at young people, important though it is that we get that aspect right. We're also working with employers and colleges in particular to shape an agile and responsive short qualifications offering which meets the needs of businesses and employees looking to upskill to meet changing needs. Then, of course, there's the review of CLD provision to identify where in the country we might have to improve that offering in order to provide people of all ages with a chance to improve their quality of day-to-day living and, of course, where applicable, access to education, training and employment. Now, I agree with him about the need to have data to underpin this. That's part of what the review is looking to do, to give us a clearer picture of what's happening. But actually, I think we know there are some issues here. We've had them identified through the Withers and others reviews. And I'm more inclined simply to get on and try and fix some of these issues.
Annabel Ewing.
Thank you, Presiding Officer. And I have to say I very much welcome the Minister's evident commitment to improve lifelong learning in Scotland. I think that is a commendable position of the Scottish Government. But I wonder if the Minister could indicate, what assessment has been made as to how to promote this objective in my Cowdenbeath constituency and indeed across the Kingdom of Fife. Thank you.
Minister.
Annabel Ewing makes a very good point, and it's actually at the heart of why I've commissioned the review, because in order to address the point that she makes and others, we need to best understand what's working well, what isn't working well, and where there are pockets of good practice and try and roll them out. So absolutely raising awareness of access to CLD offerings is important, but I want to better understand the position across the country first so that we can take steps that are informed by robust information.
Question number 6, Colin Smith.
Thank you, Presiding Officer. To ask the Scottish Government what action it has taken to attract and retain staff in colleges.
Minister Graham Day.
Presiding Officer, operational decisions, including those around attracting and retaining staff, are matters for individual colleges, and the Scottish Government expects colleges' staffing complement to be in line with the needs of their learners and their local and regional economies. The Scottish Government, through its Fair Work agenda and through its work to support the adoption of the teacher qualification and further education, continues to support the college sector in attracting and retaining college support staff and lecturing staff.
Colin Smith.
Presiding Officer, a week rarely passes when a Minister doesn't say in this chamber the reason we don't have industrial action at the moment in the NHS in Scotland is because of the actions and the intervention of ministers. So what does it say about the failure of the Government to intervene in our colleges that this week college staff and the EIS Fila Union have once again voted overwhelmingly to take industrial action? What will the Minister do in the coming days to avert this action and ensure our college staff get a fair pay deal, given that Audit Scotland have already recently warned that we face a recruitment and a retention crisis in our college, and more cuts and the lack of fair pay is simply going to make that worse?
Minister.
Presiding Officer, I'm literally just off a call with the Unite Union on this very subject. I've engaged with all the trade unions and the employers. As Colin Smith well knows, ministers cannot enforce a pay settlement in this sector. And he also knows that this is a sector where the industrial relations have been toxic, to say the least, for 8 of the last 9 years. So I am actively encouraging all sides to try and find a solution. And that is the role of ministers in all of this. Now, there is a longer-term issue about the industrial relations in the college sector. I'm intrigued by the fact that all sides recognise that, yet we haven't been able to find a solution to it. We need to find a solution to the pay dispute currently, but we also need to find a solution to the longer-term systemic problem in the sector. And if all of the actors in this are as genuine as they tell me they are, I think we can resolve both.
Liam Kerr.
Thank you, Presiding Officer. What won't attract and retain staff is a proposed cut of 8%. That's £58.7 million to the Net College resource budget. Yet recruitment of staff and students has to happen right now for next year. So, Minister, when precisely will colleges know exactly what their budgets will be for next year, and just how brutal are the cuts going to be?
Minister.
Presiding Officer, as I think Mr Kerr knows, because he is knowledgeable about these things, there is a process post the publication of the draft budget where the SFC works directly with colleges and universities to determine the specifics of the budget. That process is underway. I'm not cited on the exact details currently, though I will be in due course, and I would anticipate further detail, precise detail, to emerge in the next few weeks.
Beatrice Wishart.
Thank you, Presiding Officer. The Minister knows that there are redundancies proposed at UHI Shetland. What confidence can be given to the community that in the future we will have a Shetland college that meets the needs of local learners and local businesses that have differing sets of skills requirements?
Minister.
Presiding Officer, I'm grateful for the question. Beatrice Wishart and I have engaged directly on this matter quite recently. She's right, it's a legitimate concern about the situation at UHI Shetland. What I can assure her is that both UHI as an entity and the Scottish Funding Council are engaged directly with the college at Shetland to try and ensure that its future is there, along the lines that she would indicate, but it also has to be a sustainable position that it gets itself into. So there are some challenges there currently, but I think everyone is participating positively in trying to find the right solution for the college and for Shetland.
Question number 7, Sarah Boyack.
Thank you, Presiding Officer. And can I draw members' attention to my register of interest to ask the Scottish Government when it last met the City of Edinburgh Council to discuss its housing emergency declaration?
Minister Paul McClellan.
Thank you, Presiding Officer. The Scottish Government regularly engages with the City of Edinburgh Council concerning our shared efforts to end homelessness and reduce the number of households in temporary accommodation. On the 7th of December, I met with Housing, Homelessness and Fair Work Committee convener Councillor Marr to consider housing supply matters. On the 21st of December, I discussed budgetary matters, including housing, with Edinburgh City Council leader Cammy Day. And just yesterday, I also met with the Scottish Cities Alliance to discuss housing, which included officers and Council leader Cammy Day. Continuous dialogue between officials is facilitated through forums such as City of Edinburgh's Council Homelessness Task Force, which last met on the 13th of December. Scottish Government officials and their City of Edinburgh counterparts will next meet on the 23rd of January.
Sarah Boyack.
Can I welcome the engagement of the Minister? That is much appreciated. But say it's not just Edinburgh that's declared a housing emergency. There are other councils doing it now. And to say that last week 781 people applied for a single council house in Dreghorn. So it's a now issue, this housing emergency. And can the Minister say what action the Scottish Government will take imminently to tackle our housing emergency, whether it's bringing empty homes back into use or getting moving and building new housing, both general needs and social rented accommodation?
Minister.
Thank you, Presiding Officer. On specific issues, you will be aware that obviously we had the announcement of the £60 million allocation of acquisition funding, which we're discussing with Edinburgh at the moment about various sites that are also talking about allocation policies. The member will also be aware that we've attended a number of round tables in Edinburgh, which the empty homes issue was particularly raised. So we're working with Edinburgh in regards to empty homes. There's a few other things that we're working with Edinburgh on. There are a few strategic sites, such as Granton in the west of Edinburgh, that we're working with to try and develop as quickly as possible.
Ben McPherson.
Thank you, Presiding Officer, and I also thank the Minister for his committed engagement on the housing emergency in Edinburgh, and with appreciation to the financial constraints which are real. The situation in Edinburgh is becoming more and more serious and is more acute than elsewhere in the country. So as well as having the engagement and the official engagement in this new year 2024, can we expect action from the Scottish Government and the City of Edinburgh Council working together to really tackle this emergency?
Minister.
Yeah, thank you to the member for that question. As I said, we are engaging with Edinburgh on a regular basis, such as issues that talked around about strategic sites coming forward and acquisition policies in terms of that yesterday. Yesterday I met with the Scottish Cities Alliance and we were looking at innovative ways of financing which Edinburgh has used before, such as GAM funding and TIF funding. So we're engaging with Edinburgh on that issue and we'll continue to engage with them about bringing housing forward as soon as we possibly can.
Miles Briggs.
Thank you, Presiding Officer. We need to find solutions, and part of that is looking at our land supply issues here in the capitals. Can I ask the Minister whether or not the Scottish Government will agree to audit all public land, not just council land and Scottish Government agency land, but NHS land as well, to look towards what development sites might be available to help reduce the cost of affordable housing development significantly? We know many sites across the Edinburgh area will not necessarily be developed as part of the local plan. So I hope that's an opportunity and a positive suggestion to actually undertake a proper audit.
Minister.
Thank the member for that question. I think we're kind of touching on planning issues, but in regards to land that's available, for example, such as NHS land, I've already engaged with Paul Lawrence from the Edinburgh Council on that and Camby Day to discuss that, and I'm awaiting some evidence coming back from them about land that is available and how we can work to bring that forward, and maybe land that's not in the local development process, but we are engaging with them already on that issue.
Co-Cab Stewart.
In November last year, the City of Glasgow too declared a housing emergency, and I understand from my colleagues on Glasgow City Council that our city has around 1,500 homes less than it needs to meet demand. I know the Housing Minister meets regularly with representatives from the Council, but what work is ongoing to address the specific needs Glasgow faces, including the challenges set out by the Home Office's fast-tracking on asylum claims?
Minister.
Thank you, Presiding Officer. I met with Glasgow City Council to consider the city's housing supply challenges on the 12th of December, and we'll meet with them again on the 23rd of January. In October, the Migration and Refugees Minister wrote to the UK Government to request funding to support local authorities to manage asylum pressure. However, no additional support was forthcoming. This is deeply disappointing and a matter ministers continue to press alongside our Welsh Government colleagues. Clearly, the Home Office's approach is pushing people into destitution, and its impact in Glasgow, Scotland's largest dispersal area, is particularly acute. We will again call on the UK Government to recognise the devastating impact of their approach on local authorities, communities and asylum seekers.
Question number 8, Paul O'Kane.
To ask the Scottish Government when it last met with NHS Greater Glasgow and Clyde to discuss out-of-hours GP services in Inverclyde.
Cabinet Secretary Michael Matheson.
The Scottish Government engages regularly with Greater Glasgow and Clyde, as it does with other health boards, on a variety of issues, including the provision of out-of-hours services. Healthcare Improvement Scotland are supporting the Health Board directly in relation to the service provision in Inverclyde to ensure quality engagement is taking place around any permanent change to that service. The Scottish Government has been cited on this process.
Paul O'Kane.
Thank you, Presiding Officer. Communities across Inverclyde and my region are deeply concerned about the possibility of permanent reductions to out-of-hours services availability and what that will mean for local communities. And I want to pay tribute to local campaigners, local councillors, in particular Martin McCluskey, for all of their work in pushing the case for the value of this service forward. I think it marks quite a contrast to the member for Greenock and Inverclyde, who, according to reports in the Greenock Telegraph, has already given up the fight and accepted that his constituents and mine will have to put up with reduced services. So does the Cabinet Secretary recognise the value and importance of a full out-of-hours service in Inverclyde? Will he listen to local people and their views and deliver more than just a weekend-only out-of-hours service, which is what local people deserve?
Cabinet Secretary.
Presiding Officer, the member will be aware there has been a full consultation exercise undertaken by Greater Glasgow and Clyde that closed last month, which is presently being analysed by the board. And obviously, Healthcare Improvement Scotland have a clear process in looking at any what may be classed as a major service review. I think, of course, it is important to recognise that the reintroduction of the service, the part-time service on a Saturday, also complements the existing home visiting service, which remains operational throughout the evenings, weekends and overnight. But, of course, it is important that in any decision that's arrived at, that the consultation exercise takes into account the concerns and issues which have been raised by the local community during the course of that process.
Stuart McMillan.
Thank you, Presiding Officer. Presiding Officer, whilst it is frustrating that the GP out-of-hours service in Inverclyde is to be limited to Saturdays and public holidays, having attended one of the Health Board's public consultations on the service changes, I am aware that just over a third of people from Inverclyde who need to see a GP out-of-hours are given a face-to-face appointment, with the remainder giving either video, telephone or home appointments. And I do want to see a full service reinstated to Inverclyde, but not at the extent of losing the A&E, which was very much highlighted at the consultation that I attended. If Mr O'Kane was there, he would have heard that. But certainly, Presiding Officer, does the Cabinet Secretary agree with me that it's important that we do consider the full context in which these decisions have been taken and ultimately do not mislead the public, as some have done in the press, by suggesting that Inverclyde does not have a GP out-of-hours service?
Cabinet Secretary.
Well, Presiding Officer, I recognise the concerns and issues which the member has raised, and I've made this point in terms of the services which are available, including the home visiting service, which remains operational throughout evenings, weekends and overnight. And it's important that people are not left with the impression that there are no services being available within the Inverclyde area. I do agree with the member that we would like to see greater coverage of our service across Greater Glasgow and Clyde, including within Glasgow, including within Inverclyde itself. And I want to make sure that the process that's been taken forward by the board as part of the consultation exercise is in line with the Healthcare Improvement Scotland guidance on these matters. And at the conclusion of that particular exercise, we have a clearer understanding as to what's the most appropriate path to dealing with out-of-hours services within the Inverclyde area.
And briefly, Jamie Green.
Thank you, Presiding Officer. One of the problems with not having out-of-hours GP services is that people simply will present at A&E, adding more pressure to what is already an overstretched department, particularly in Inverclyde Royal Hospital, as is the case right across Scotland. So can the Cabinet Secretary explain what additional resource support he can offer A&E departments to deal with this influx of patients when there are no other services available?
Cabinet Secretary.
Well, Presiding Officer, I think we have to wait to see what the outcome is of the consultation exercise in Inverclyde, but I don't disagree with the point he's making about the potential impact that it can have on A&E departments if there is no access to out-of-hours services. So, for example, this winter there was specific work taken in order to make sure there was greater resilience within our out-of-hours services across the country, which has been effective over the course of the last month or two because of the actions which we have taken. Notwithstanding that, I do recognise the concerns he's made, which is why the consultation exercise and outcomes from that are ones that we will look at very closely in terms of the impact it could have on wider services.
Thank you. That concludes general questions. The next item of business is First Minister's questions. At question number 1, I call Douglas Ross.
Thank you very much, Presiding Officer. And can I begin by putting on record the best wishes of, I'm sure, the whole Chamber and people across Scotland to His Majesty the King and the Duchess of Rothesay. We wish them both a speedy recovery to good health. Last week, in response to the Horizon scandal, the First Minister said this: "I think the idea of almost a mass exoneration is one that is very worthy of consideration." And in a letter to the Prime Minister just 8 days ago, he said, and I quote, "It is right that normal processes for appeals are set aside." But in a statement this week, the Lord Advocate, his government's top legal adviser, said, and I quote, "In Scotland, there is an established route of appeal in circumstances like this." So Humza Yousaf has said that there should be a blanket exoneration, but the Lord Advocate believes that the current process for appeals shouldn't change, with each case being considered individually. So can the First Minister tell not just Parliament, but crucially all the victims of this scandal, what the position of his government actually is?
First Minister.
Can I thank Douglas Ross for the question? Can I also associate myself with the remarks and wish a speedy recovery to both King Charles and, of course, the Duchess of Rothesay too. In relation to this issue, let's first and foremost begin by paying tribute once again, not just to Alan Bates, but to those hundreds of sub-postmasters and mistresses right across the United Kingdom that should not have had to wait for an ITV drama in order to see justice or indeed in order to see compensation. But, of course, it is important that the UK Government has acted. Douglas Ross is right. I wrote to the Prime Minister. I should say I've received a response back from the Prime Minister. The response is a positive one, that he is willing to work on a UK-wide basis. I should say happy to release that response, though I think we're waiting for Number 10 to confirm that they're also happy for us to do so. But that detail in that response does say that the UK Government are willing to work with the Scottish Government in order to look at a UK-wide basis for mass exoneration for those who have been wrongfully convicted. I listened very carefully to what Lord Advocate had to say, both in her statement and indeed in response to questions. She was making the point, of course, that there is a current appeals process through the Scottish Criminal Case Review Commission as well in order to investigate mass miscarriages of justice. But let me just be clear, so Douglas Ross has no misunderstanding. We support the UK Government looking at legislation for mass exoneration of those who are wrongfully convicted, and we've written to the UK Government, got a positive response back, and we hope that the legislation can apply on a UK-wide basis.
Douglas Ross.
Well, that doesn't actually clear up the case here in Scotland. Well, the First Minister says it does, but of course the UK legislation will apply in England and Wales, but this issue is devolved here in Scotland. And we have his top legal officer who sits in the Scottish Government Cabinet saying something quite different to the First Minister. Let me quote again from the Lord Advocate on Tuesday. "It's an important process because not every case involving Horizon evidence will be a miscarriage of justice, and each case must be considered carefully." That's the Lord Advocate's current position. So what that is a refusal to change the process and accelerate the system because there may be some guilty people. Surely it's better to accept the tiny possibility that a guilty person will have their conviction overturned than allowing dozens of innocent postmasters to live with the stain of guilt for a minute longer. So can I ask the First Minister, what discussions has he had with the Lord Advocate since her statement on Tuesday, and does he agree that these convictions must be quashed as quickly as possible?
First Minister.
The Lord Advocate and I are due to speak again tomorrow, I believe. But what I would say to Douglas Ross is that Lord Advocate, when she was speaking in the Chamber, of course, was speaking as the independent head of prosecutions. That is an important part of her function, which is distinct, of course, to her position when she provides legal advice as a member of this government. It's still my preference, I should say, that there is the UK-wide basis, UK-wide legislation, as UK legislation is applied on a UK-wide basis through an LCM. I think that would be the preferable route. Now, there are complexities to work through there. I think that the choice that Douglas Ross is presenting as a binary choice is not the correct one. The best position for all of us is urgently seeing the mass exoneration for those who are wrongfully convicted. And of course, for those whose conviction was sound and is sound, nobody wants to see necessarily their conviction overturned and then being able to apply for compensation. So if we can get the best of both worlds, if we can get to that position, that is the best position to get to. And that is why we're willing to work with the UK government, who presumably also don't want sound convictions overturned if they can avoid that. We will work with the UK government in that respect. But let's not forget about what we are dealing here. This, I'm afraid, is a scandal that was born in Westminster. This is a post office that is wholly reserved, wholly responsible to UK government ministers. I accept lied to UK government ministers.
Briefly, First Minister.
But UK governments clearly did not interrogate the post office strongly enough, and therefore the public inquiry is important, and I would urge the UK government to make sure they fully cooperate with that public inquiry.
Douglas Ross.
The Crown Office is wholly devolved here in Scotland. That's why the situation is very different here. The Post Office could not prosecute these individuals here. It was the Crown Office. One of those who was prosecuted was Judith Smith. She pled guilty in 2009 at Selkirk Sheriff Court to a charge of fraud after thousands of pounds disappeared. Judith's lawyer told us that the Crown Office displayed a worrying lack of scepticism at the Post Office's case, particularly as there was no trace of the money anywhere. Judith was even asked if she'd blown it all on a lavish holiday or if she had a gambling problem. Her conviction was finally quashed just last week, but Judith's lawyer said the Crown Office should have launched a review of all past Post Office prosecutions the minute it became aware of the Horizon problem in 2013. They didn't, and it took a further 2 years for prosecutors to dismiss ongoing cases that relied on Horizon evidence. So can the First Minister explain why prosecutions in Scotland continued for 2 more years after the Crown Office became aware of concerns with Horizon? And does the First Minister agree with the Scottish Conservative calls that the Lord Advocate at the time, Frank Mulholland, should come to this Parliament to answer questions on this scandal?
First Minister.
First of all, can we be clear? What it took was an ITV drama in order to get the UK government to make sure that they took action, even though they were being told by hundreds of sub-postmasters and mistresses up and down the country that they had been lied to. So let's not forget that is what spurred the UK government into action, not the pleas and the desperate pleas of sub-postmasters right up and down the country. And let's go back to the point, of course, that the Lord Advocate made, I think very clearly in this chamber, that the Crown was, in her words, I believe, misled and given false reassurances by the UK Post Office, time and time and time again. And I have to say, hearing the harrowing testimonies, including, of course, the one from Judith that Douglas Ross just articulated, there are many institutions that will be answerable for what they did and the action that they took. And I would fully expect, and I'm certain it will be the case, that the Crown Office would also, of course, fully cooperate with the public inquiry underway. In terms of why the Crown chose to prosecute cases post-2013, again, the Lord Advocate laid that out, laid out the fact that, of course, there was guidance to prosecutors in 2013 involving Horizon cases, and, of course, then they stopped prosecuting cases in 2015 that were sufficiently dependent on Horizon data. In terms of Lord Advocate, of course, the current Lord Advocate is responsible and answerable for the Crown. Of course, she has already answered questions about what took place in 2013, and she has already said if MSPs want a further opportunity to question her, then she will make herself available.
Douglas Ross.
Of course, my question was about one of her predecessors, and I think it is crucial that this Parliament hears from Frank Mulholland, and it would just be interesting to know if the First Minister supports those Scottish Conservative calls. Because all of this matters here in Holyrood, because the Crown Office is a devolved institution. The procedure by which these convictions can be quashed will be set by this Government and this Parliament. But the process set out by the Lord Advocate could see that taking far, far longer in Scotland than it should. Myra Philp worked with her mum Mary at the Post Office in Auchtermuchty in 2001. At 7 a.m. one morning, Post Office auditors burst through the door and demanded the keys to the shop. Mary, a former policewoman, was suspended, but she immediately suspected Horizon was to blame. The Post Office, on the other hand, blamed her teenage grandchildren. Auditors accused them of breaking in during the night, overriding the time lock and taking the money. Now, Mary wasn't prosecuted, but she lost her business. She died in 2018, the year before Alan Bates forced the Post Office to admit Horizon was desperately flawed. Myra told us this: "My mum died not knowing she was right." The Lord Advocate is head of the independent judiciary in Scotland, but she is also the chief legal adviser to the Scottish Government and the Cabinet. So does the First Minister accept that if we follow the position the Lord Advocate laid out to the Scottish Parliament of her preferred process, it will take far too long for postmasters wrongly convicted, and some could die before their names are cleared?
First Minister.
Can I give clarity once again, not just to Douglas Ross, but to Mary's family, to all the other sub-postmasters, sub-postmistresses right across Scotland. The UK Government last week announced that they were looking to bring forward legislation in the UK Parliament in order for mass exonerations to take place when it comes to wrongful convictions. I have written to the Prime Minister to say we welcome that process. And not only that, as the First Minister, that we'd be willing to work with the UK Government for that legislation to take place and have effect on a UK-wide basis. Now, that could be through an LCM. I should say to Douglas Ross, if an LCM, for whatever reason, the UK Government, if that is not possible, we are already working on contingencies that are in separate Scottish legislation if that is required. I hope not. I think that if there is a possibility for an LCM, that would be the easiest and the quickest route. I, as the First Minister of Scotland, will decide what legislative route, of course, is brought forward to this Parliament in order to exonerate those who are wrongfully convicted. Let's say once again that harrowing testimony that Douglas Ross has given in relation to what Mary had to suffer, and no doubt the consequences are still felt by her family. That happened on the UK Government's watch. That happened because of a post office that's wholly reserved to the UK Government. And UK Government ministers of UK-based parties, time after time after time, did not believe sub-postmasters and sub-postmistresses like Mary and others who were being harassed by the Post Office at the time. And they have waited far too long for justice. And let me give an absolute confirmation and assurance to them that we will work with the UK Government and whoever else we need to make sure there is not a single day longer that they have to wait, not just for justice, but for access to compensation.
Thank you. Question number 2, Anas Sarwar.
Can I echo the best wishes to King Charles and the Duchess of Rothesay and wish them both a speedy recovery. Presiding Officer, confusion about the ban of XL dogs in Scotland has brought dangerous dogs back into the headlines. Today, the SNP government will finally make a statement, and I hope they take action. But like so many issues, it is only when media pressure builds that SNP ministers respond. Too often they act on headlines rather than the evidence. In the last Parliament, I sat on the Public Audit and Post-Legislative Scrutiny Committee when it produced a report on the 2010 Control of Dogs Act. The cross-party committee called for a review of the law and the focus to be on irresponsible owners and breeders. The Government accepted the findings of the committee and committed to a review in 2019. So can I ask the First Minister, nearly 5 years on, why are we still waiting?
First Minister.
Like I say, of course, there was something that happened between 2020 and, of course, the current time, and that was a global pandemic, which, of course, undoubtedly resulted in the fact that other work had to be delayed. I think most individuals would accept that. In terms of the XL bully safeguards that the UK Government have brought in, they, of course, made that announcement without a single word of consultation with the Scottish Government. I suspect if at that point I had said to Anas Sarwar that yes, we will take immediate action, he would have demanded what consultation we had had. So it was right that Siobhan Brown took the time to have consultation with, of course, animal welfare stakeholders, with those who are involved in animal rehoming centres. I should say the Scottish Government still absolutely believes that the correct approach is indeed not breed, but we have to also be able to respond to the fact that we've seen media reports of a number of people bringing their XL bully dogs over the border to Scotland. So we have consulted, we have taken time to engage, and we will bring forward safeguards. And it should be said, this is not a ban. Of course, people will still be able to have their XL bully dogs if they, of course, meet the criteria of the regulations that are brought forward. But let me say to Anas Sarwar, that when it comes to the stricter regime that we have in terms of the Control of Dogs Act, in terms of the various notices and the stricter regime that we have here in Scotland, I'm pleased that we have a strict regime here in Scotland that isn't available elsewhere in the UK.
Anas Sarwar.
I know the First Minister is not good in the detail, but the review of the Control of Dogs Act was in the programme for government in 2021 during COVID, so I'm not sure that excuse holds any water. In 2022 alone, victims were treated in Scotland's hospital a reported 7,600 times for injuries inflicted by dogs. These dogs were out of control, often mistreated or poorly trained by their owners. Many of the injuries people sustained disfigured them for life. Kirstine Hobson is a postwoman in Oban. In December, she was brutally attacked by a German Shepherd and sustained serious injuries to her face, leg and arm and needed specialist plastic surgery. She'll be scarred for life, emotionally and physically. But nothing that the government is announcing today would have helped Kirstine. The government promised 5 years ago to take action against irresponsible owners and breeders, not just an individual breed. So if the government can act on XL bullies, what will it take for them to protect people like Kirstine and so many others that they have repeatedly promised to do?
First Minister.
My sympathy goes to Kirstine for the injuries that she has suffered. But just to say to Anas Sarwar, of course, that we did take action on the back of the work done in 2019. That's why we have a really important regime of dog control notices. That is the regime that I'm talking about that does not exist in England and Wales. And if Anas Sarwar had the detail in front of him, he would know that. He would also know, of course, that there are currently more than 1,200 active dog control notices in place in Scotland. And XL bully dogs, we know, represent 2% of those DCNs that are in force. So one dog attack is, of course, one too many, and we've taken a whole range of actions to protect communities as best we possibly can. And that dog control notice regime that we do have undoubtedly will help in that regard. But we will continue to work with Police Scotland, with local authorities, with the SSPCA and indeed other relevant interests to keep communities safe from the very small minority, and we should be clear about that, it's a very small minority of irresponsible dog owners for their dangerous dogs.
Anas Sarwar.
7,600 treatments in hospital related to dog attacks in one single year. I don't think the First Minister should be playing that down, because that will be of extreme concern to families across the country. Humza Yousaf was, of course, Justice Secretary when this government promised to review the Control of Dogs Act, and still nothing has happened. People like Kirstine shouldn't have to be fearful when they go to work, and parents shouldn't have to fear for their kids when they take them to the park. This government has a responsibility to protect people, not just respond to bad headlines. But too often, sadly, that is the case. We saw it with the infection scandal at the Queen Elizabeth Hospital. We saw it last week and again today with the Post Office scandal. And now we see it with XL bully dogs. So this government must commit to stronger powers for councils and the police and make it clear that the responsibility for dogs lies with owners and breeders. So does he accept that we can't wait until another 7,000 people are harmed before this government fixes the Control of Dogs Act?
First Minister.
Can I say to Anas Sarwar, his third question there took no account at all of the response that I gave to his previous question. That is the problem, because Anas Sarwar says
we failed to act. If he had stopped just reading the pre-prepared script, he would have, of course, heard me say that we brought in a DCN regime, that dog control notice regime that came in, that does not exist in England and Wales. And the fact that we have that in place has meant, of course, that we have more than 1,200 active dog control notices in place as we speak. So we'll continue to work, of course, with Police Scotland, with local authorities, the SSPCA and other relevant stakeholders to keep our communities safe. We've established on top of that an operational working group involving local authorities, Police Scotland, COSLA and key stakeholders to progress this work. We've also commissioned a national dog control notice database to help enforcement agencies better monitor the control of dogs. When it comes to having to respond to the UK Government's actions, and that's what we're having to do in this case, wouldn't it be far better that we didn't have to always respond to what the UK Government does and instead have the full powers here in Scotland, Presiding Officer?
Question number 3, Alexander Stewart.
Thank you, Presiding Officer. To ask the First Minister what the Scottish Government's response is to reports that Scotland has among the worst survival rates for some of the most serious cancers.
First Minister.
Cancer remains a national priority for the NHS and the Scottish Government, which is why we published a 10-year strategy in June 2023 focused on improving cancer survival and providing equitable access to treatment. It includes a focus on the less survivable cancers and improving their outcomes. The strategy and the plan take a comprehensive approach to improving patient pathways in cancer, from prevention and diagnosis right the way through to treatment and, of course, post-treatment care. I'm very heartened by the fact that overall cancer mortality in Scotland has decreased by 11% over the last 10 years, but we recognise, of course, we have much more to do, particularly when it comes to less survivable cancers. And I can put on record the fact that I know Alexander Stewart has raised these issues on a number of occasions, and the importance that he attaches to this is shared by the Government too.
Alexander Stewart.
I thank the First Minister for that response. The SNP Government have been responsible for running health for nearly 17 years. Data shows that out of 33 countries of comparable wealth and income levels, Scotland ranks as low as 32nd for a 5-year survival from pancreatic cancer, 31st for stomach cancer and 29th for lung cancer. First Minister, you should be ashamed that your government has allowed the 5-year survival rates for these cancers to deteriorate to some of the lowest in the developed world. And what action will you take to resolve this?
Always through the chair, please. First Minister.
When of course, there are those type of rates and survival rates, then there is work for the Scottish Government to do. There's no getting away from that. I have spoken often about my own personal experience in relation to pancreatic cancer. I lost an uncle, a dear uncle, to pancreatic cancer. So it's an issue that's very personal to me. I should say, of course, there are areas where we compare very favourably to those 33 countries in terms of liver cancer, for example. Survival rate, Scotland is 12th, whereas the UK overall is 21, England 25th place. So there are other cancer types where we're seeing progress, but clearly in other areas such as pancreatic cancer, stomach cancer, brain cancer, lung cancer, there's still much more for us to do. In relation to what we are doing, I'll make sure the Cabinet Secretary for Health writes in detail to Alexander Stewart, but what we are doing is trying to speed up diagnosis where we can, and that's why we're investing in our Detect Cancer Early programme, but also investing in the rapid cancer diagnostic services which are currently operational in 5 NHS boards across Scotland, and the early evaluation from those rapid cancer diagnosis services do show that HPV, liver and pancreatic cancers, are amongst the most common cancers that are being diagnosed through that pathway. So overall, of course, as I go back to this point and end on this point, Presiding Officer, the overall cancer mortality in Scotland has decreased by 11% over the last 10 years, but less survivable cancers, as Alexander Stewart says, there is clearly still work to do.
David Torrance.
Thank you, Presiding Officer. While Labour MSPs shamefully failed to support minimum unit pricing, a policy which has proven to save lives and reduce hospital admissions since its inception, what assessment has the Scottish Government made on the impact of policies like minimum unit pricing on liver cancer rates in Scotland?
First Minister.
Well, Public Health Scotland evaluation of minimum unit pricing shows that MUP has had a very positive impact on health outcomes during the study period. It's estimated to have cut alcohol consumption, alcohol attributable deaths, and likely to have reduced hospital admissions. Public Health Scotland estimates that about half of liver cancers are preventable in the UK, and that's why we continue to take action on the most prevalent factors, particularly, of course, including alcohol consumption. Prevention of cancers takes longer to realise, but we would be hopeful that MUP impacts will be seen in the future for liver cancers. Our cancer strategy does place a focus on less survivable cancers, including, of course, liver cancer as well.
Jackie Bailey.
I recently met with a courageous group of women from the west of Scotland who shared their experience of being diagnosed with ovarian cancer and being forced to use their family's life savings to fund private treatment in England. According to Target Ovarian Cancer, those in the west of Scotland cannot access life-saving surgery that women in NHS Lothian can access. Consequently, they face poorer outcomes when it comes to survival rates for the disease. It is nothing short of a national scandal that women with ovarian cancer are having to pay for the surgery they need and deserve because of where they live. Can the First Minister tell us why women in the west of Scotland can't get surgery and what urgent action is being taken to end this life-threatening postcode lottery?
First Minister.
Well, again, I'm happy to ensure that the Cabinet Secretary for Health writes in detail to Jackie Bailey about what actions are being taken. I don't want anybody in the country, regardless of what the condition is, but particularly when it is cancer, to have to wait a day longer than they have to in order to get treatment. We know the earlier that cancer is diagnosed, the earlier that treatment begins, then the better chances in relation to survival. And that's why we've taken action to increase the number of consultant oncologists, for example. There's been almost a 100% increase since the SNP has been in position. We've increased the consultant radiologists by over 66% as well. In terms of private health care, again, when Scotland is compared to the rest of the UK, we see fewer people having to self-fund for any private inpatient day case care. Notwithstanding all of that, of course, the work that we are doing in order, particularly on ovarian cancer, is one that I want to see extended right across Scotland, so that there is not a postcode lottery of care. And I'll ensure the Cabinet Secretary for Health writes in detail to Ms Bailey.
Question number 4, Emma Harper.
To ask the First Minister, in light of reported concerns regarding food labelling being a devolved matter, what the Scottish Government's position is on what impact the UK Government's reported plans to roll out not for EU labelling on food and drink products across the whole of the UK could have on Scotland's food and drink industry.
First Minister.
The Government shares the well-documented concerns that Food and Drink Federation Scotland, many food and drink businesses have highlighted about these labelling plans. The Rural Affairs Secretary, Mary Goujon, wrote to our UK Government counterpart before Christmas for much-needed clarification on their plans. However, my understanding is she's not had the courtesy of a response yet. However, we will continue to press the UK Government for answers, not least to the questions of why they're insisting on pursuing a policy that would arbitrarily add costs to all agri-food businesses, not just those who trade specifically with Northern Ireland. This is a move which is disproportionate, it's wholly inappropriate, particularly when consumers are already bearing the burden of added food costs. It's just another example, frankly, of Conservative chaos harming our economy.
Emma Harper.
Thank the First Minister for that response. I agree with the First Minister about the impact and the harm that this will cause many Scottish food and drink businesses. Would the First Minister also agree that while this might be needed for goods being traded with Northern Ireland, there is no rationale for it for other trade? Has the Westminster Government shared why it intends to impose this regime?
First Minister.
No, they haven't. We've again written to them, but of course we've not had the courtesy of a response. There's not any real evidence or convincing argument for why this labelling requirement is necessary. And of course, those food and drink stakeholders in Scotland that have added so much to our economy are absolutely scathing about the UK Government's plans. The Food and Drink Federation Director for Growth, Bawinder Dutt, says, and I quote, "Our members are really clear that the Government's plan to extend not for EU product labelling on a UK-wide basis will hamper growth, hitting investment, exports and jobs, while increasing consumer prices and restricting the choice of products." The evidence is clear. The independent analysis is clear that Brexit is damaging our economy, and that's why it is utterly unforgivable that not a single UK-based party is standing up against Brexit, or even proposing that we rejoin the single market, a market 7 times the size of the UK. And the people of Scotland should be given that choice? Do they want to stay in broken Brexit Britain?
Briefly,
or do they
First
want
Minister.
to make decisions for ourselves as an independent nation in the European Union?
Rachel Hamilton.
Thank you, Presiding Officer. The UK Government will launch a consultation on a new food labelling scheme which will ensure that consumers know what they are buying. They're buying high-quality British produce over imported goods that don't meet UK welfare standards. Does the First Minister support this move, and can he explain how he expects Scottish farmers and fishermen to continue to provide high welfare and environmental standard food when his SNP budget is cutting £46 million from the Rural Affairs portfolio?
First Minister.
Another Brexit burden for businesses in Scotland to have to bear, even though, of course, we didn't vote for Brexit. But the damage,
Let's hear the First Minister.
burdens of Brexit are being imposed upon our businesses up and down Scotland. So I don't think businesses are lining up to thank Rachel Hamilton's Conservatives for the imposition of Brexit. Quite the opposite. We have, of course, even the British Retail Consortium saying that given labelling is intended to prevent goods from GB entering the EU through Northern Ireland, it's unclear why such labelling is necessary for all goods sold in Great Britain. This will only add unnecessary costs at a time when the cost of living is already so high. So the SNP is the only party that's standing up against Brexit, the only party that says we should be rejoining the European Union, rejoining, of course, that single market that is 7 times the size of the UK market. When the choice is so clear, Presiding Officer, it's no wonder the Conservatives fear the verdict of the Scottish people.
Question number 5, Douglas Lumsden.
To ask the First Minister what percentage of the premises contracted for delivery of superfast broadband under the R100 scheme have still to be connected.
First Minister.
All homes and businesses across Scotland can currently access a super-fast broadband service. The R100 contracts are going beyond that by extending access to gigabit-capable broadband that's over 30 times faster than our original commitment. Our programme does remain on track to complete build and ensure all contracted premises are connected by 2028. So far, over 36,100 premises have been connected, and the remainder will be phased between now and 2028. The Scottish Government has prioritised investment in digital connectivity in the 24-25 budget, despite, of course, swinging cuts from the UK Government, recognising, of course, that digital connectivity is a key building block for a green and growing economy.
Douglas Lumsden.
First Minister, the R100 scheme was meant to connect over 114,000 premises, mainly in our rural areas, by 2021. From a Freedom of Information request, we know that only 29% of these premises have been connected, and the figures in the north are even worse, with only 15% delivered. And the scheme for North Scotland has slipped to 2028, 7 years late. So does the First Minister accept that this abject failure by his government is leaving our rural communities behind, and will the R100 scheme be delayed any further?
First Minister.
Well, first of all, Presiding Officer, we do have a strong track record of delivering successful digital infrastructure. Our broadband initiatives have delivered almost 1 million connections to date. But for Douglas Lumsden to ask about telecoms, when telecoms is wholly reserved to the UK Government, well, you couldn't mark his neck with a blowtorch, Presiding Officer, because we have a strong track record. We have invested. In fact, when it comes to rural Scotland, we've invested 3 times more in the R100 North contract than we have in the Central or South contract. So any suggestion that the North of Scotland has been neglected is simply untrue. But despite the fact that telecoms legislation is wholly reserved to Westminster, the UK Government has invested just £49.4 million of the R100 programme. This stands in stark contrast to the £592 million that the Scottish Government has invested. Presiding Officer, if we left it to the UK Government, we would all be using dial-up modems, Presiding Officer. So thank God and thank goodness for the SNP stepping
First
in.
Minister.
And through our efforts, of course, we've delivered over 1 million broadband connections to Scotland.
Thank you. We must move on, and I call Beatrice Wishart.
Thank you, Presiding Officer. The First Minister may recall media coverage of the eye-watering quote of £725,000 given to Shetland residents to get connected to superfast broadband. The broadband voucher scheme, even when pooled with neighbours, wouldn't have covered the cost. Another constituent is investigating the possibility of a community scheme, but finds that inflation has impacted the scheme's real terms value. Is it time for a rethink of the current voucher scheme offer?
First Minister.
I'm happy to look at the important issue that Beatrice Wishart does raise. We have had some success when it comes to our R100 programme on a number of our islands, sometimes our most remote islands. I know, of course, Beatrice Wishart is asking me about Shetland in particular, but when it comes to our contract build on Fair Isle, it was delivered almost 2 years ahead of schedule in one of the country's most challenging rural locations. What I would say to Beatrice Wishart is the issues that she raised are important. Of course, if there are tweaks that we can make, understanding particularly the complexities in our island communities, then we're always happy to consider that.
Question number 6, Evelyn Tweed.
To ask the First Minister what steps the Scottish Government is taking to ensure that information on sexually transmitted infections is accessible in light of STIQ Day and the reported rising number of cases of sexually transmitted infections in Scotland.
First Minister.
Ensuring that people have access to the information and services they need to make informed choices and to take care of their sexual health is absolutely vital, which is why there are outcomes in our Sexual Health and Bloodborne Virus Action Plan. The plan that was published in November just last year sets out the priority areas for action over the next 3 years and is backed by £1.7 million of government funding. The Scottish Government is funding a number of projects to support these priorities, including the development of a new sexual health website hosted by NHS Inform and production of accessible animated information resources on key sexual health topics, including STI testing in a range of community languages. Vaccinations against STIs also continue to be important in the protection of treatment and disease.
Evelyn Tweed.
Research published by the BMJ last year found that young people in rural and island communities face practical and social barriers to support for sexual well-being. Can the First Minister outline what steps the Scottish Government is taking to ensure access to timely STI testing in these areas?
First Minister.
That's a really important point that Evelyn Tweed rightly raises around the particular complexities and nuances that our rural communities face in relation to sexual health care. And rural communities do face very unique challenges when it comes to accessing healthcare. Sexual health is no different to that. And that's why, of course, we don't believe that one size fits all when it comes to delivering healthcare in particular. So NHS boards, they're the experts on their communities, which is why we work with boards to ensure appropriate tailored approaches that are very suitable to local needs. And there's a number of projects that we have invested through our sexual health and BBV action plan, which include a significant focus on rural communities. These include, for example, outreach services in Ayrshire and Arran, and exploring the delivery of HIV pre-exposure prophylaxis and primary care in Grampian.
Carol Mockin.
Thank you, Presiding Officer. Given the importance the First Minister places on this issue, can I ask the First Minister to acknowledge that there are often limited access to in-person sexual health services, particularly, as was mentioned, in rural areas. Even in more urban areas, clinic times can be limited to one session per week, and NHS Inform indicates workforce pressures are causing operational hours to be changeable. Given all of this, can I ask the First Minister what additional investment has been made in sexual health services to ensure face-to-face appointments can be provided appropriately when requested?
First Minister.
And I think the point being made by the member is very important indeed. And of course, there will be a number of people who want that face-to-face service. There will be a number of people who don't want that face-to-face service. And we should say, all of us, I'm sure collectively, that there is no stigma in relation to sexual health. People should be able to access the care they want when they want it, and however they want it, be it face-to-face or indeed otherwise. In terms of the funding that we're providing, I've mentioned the action plan. It's backed by £1.7 million of funding to improve sexual health and bloodborne virus outcomes. Grants totalling £800,000 have been distributed between a whole wide range of projects including high-quality innovative projects with health boards, third sector organisations and academia. Many of them provide that face-to-face service that Carol Morgan rightly raises. In terms of wider funding for the health service, of course, I'm very pleased that, notwithstanding the fact that we have swingeing cuts from the UK Government in terms of our budget, we've increased our investment in the NHS to a record £19.5 billion.
Move to general and constituency supplementaries, and I call Stuart McMillan.
Thank you, Presiding Officer. The First Minister will be aware of the McClure solicitors' collapse, which happened in 2021, leaving an estimated 100,000 people affected UK-wide. The firm were a Greenock-based company with many clients locally. The Trust and Succession Scotland Bill passed in December, and the current Regulation of Legal Services Scotland Bill will hopefully make similar situations in the future more manageable. However, would the First Minister provide an assurance that the Scottish Legal Complaints Commission will be supported, if they require it, to deal with the expected increase in complaints relating to McClure's, as former clients become aware of the collapse and as public information events take place similar to the one hosted at the Beacon in Greenock with the SLCC earlier this week, which was attended by 150 people?
First Minister.
Yes, I'm hopeful that the SLCC will be appropriately funded, and I'll come to that point very shortly. I'm aware of this matter. I appreciate, as Stuart McMillan has rightly said, the distress that this continues to cause. And I can't obviously comment on individual cases. The Scottish Government has taken proactive steps to mitigate against such a situation in the future. And Stuart McMillan again is right to raise the issue of the regulation of Legal Services Scotland Bill. Introduces authorisation of legal businesses, bringing benefits such as greater consistency in regulating legal firms, enabling the regulator to identify and address deficiencies early doors. I understand the concerns which the member does raise. The SLCC, in terms of funding, is funded by a levy paid by legal professions in Scotland, and the SLCC require to forecast trends in complaints when considering their budget in order to set the levy. So any proposed levy does take into account the consideration of potentially increases in complaints, such as complaints relating to the matter that has been raised.
Pam Gossel.
Thank you, Presiding Officer. Early this week, I attended a protest against East Dunbartonshire Council's plans to close the Milan Daycare Centre. Milan provides a fantastic tailored service to elderly and vulnerable ethnic minority clients. Its service users all say that Milan should be a model for the rest of Scotland to follow, rather than something to be closed down. Can I ask the First Minister, does he agree that local services should cater to all communities, including the needs of ethnic minorities? And what can the Scottish Government do to save Milan and other centres like that?
Minister.
I thank Pam Gossel for raising the issue of the Milan Centre. Just this week, yesterday in fact, I met with the Scottish Hindu Foundation, a recently established organisation speaking on behalf of the Hindu community, and they raised the issue of the Milan Centre to me, and I said, of course, that we would engage with the local authority, in this case, East Dunbartonshire, in order to see what more we could do in order to assist. But, of course, these are decisions that are being made by local authorities, and that is why, of course, when the Cabinet Secretary for Finance, Deputy First Minister, announced our budget, she announced an uplift for local government. So I do agree that community services are, of course, incredibly important. They should cater to the needs of all of our diverse communities. What doesn't help, of course, is that we continue to receive a £500 million cut in our block grant since 22-23. But despite those swingeing cuts, we have decided to prioritise local government by giving them an uplift in 24-25.
Pauline McNeill.
Turning Point 218 in Glasgow will close in February. Glasgow City Council presented the service with an unworkable budget of £650,000, down from £1.5 million. But the funding was previously ring-fenced by the Scottish Government, who signed off a reduction in this funding in a letter on the 31st of May last year. And this decision has effectively resulted in the closure of the service. Is the First Minister content that there is now no bed facility for women offenders with drug use as the main problem which has kept hundreds of women out of jail? The Lilia Centre in Maryhill, which is brilliant, cited by the Cabinet Secretary in her response, is not an alternative to custody disposal. Ministers surely cannot wash their hands of this tragic outcome.
First Minister.
I know the 218 project well. I visited the 218 project in the past when I was on the Justice Committee many years ago, and it's a project that I know is doing some excellent work. This is, of course, a decision made by Glasgow City Council in relation to the services that they're able to fund. I am more than happy, of course, to ask the Justice Secretary to engage with Greater Glasgow, Glasgow City Council on this particular issue, because I know the excellent work that Turning Point 218 has done over the years. We know, of course, by giving that really intensive support to female offenders, we can stop that cycle of reoffending. So it is a project that I know of and that I value very, very highly. Of course, we have maintained our budget in relation to the National Mission on dealing with drugs deaths in particular, but this government, nobody should be in any doubt, believes in community justice disposals, and that's why I'll ask the appropriate Cabinet Secretary to pick this issue up with Glasgow City Council.
Kevin Stewart.
This morning, it was sad to hear that Marks and Spencers have decided to close their Aberdeen St Nicholas Street store, a blow that has been lessened by the fact that they intend to invest and expand Union Square in Aberdeen. However, the site of St Nicholas Street on Union Street is a very important one, and I've asked the local authority and other stakeholders to come together to form a task force to ensure that we can have a bright future for that site and Union Street as a whole. The First Minister has previously ensured investment in our Union Street project to help with regeneration of Aberdeen city centre. Can I ask him if the Government would serve in such a task force if it comes to fruition, and I hope that he will agree to do so.
First Minister.
I'll be certainly happy to give that consideration. As the member has already rightly said, of course, we value our city centres, our town centres, and we are working hard to make sure that they are as vibrant as possible. A flourishing and vibrant city centre is essential, in fact, for the social and economic well-being of our cities and of Aberdeen as well, of course. That's why we provided, as the member said, £400,000 to the community-led Aberdeen Our Union Street initiative, which aims to revitalise the town centre, building on the city centre's regeneration plans. But if Kevin Stewart can furnish me with the details of the task force that he is proposing, then of course we will give that due consideration.
And Liz Smith.
Thank you. 4 months have passed since the Scottish Government announced a full public inquiry into Professor El Jamel, but we still have no confirmation of the appointed chair, no confirmation of the start date of the one-to-one clinical reviews, and as revealed by the Courier newspaper, no confirmation from you as First Minister that the public inquiry will start in 2024. So can I ask the First Minister for confirmation on all these points?
First Minister.
Yes, it's fully my expectation, of course, that the public inquiry starts in 2024, and by that, of course, we should have a judge appointed, an inquiry chair appointed very shortly, I would hope, because the Lord President rightly has been involved in the process of appointing an inquiry chair, and discussions, I can say, are at a very advanced stage. Planning for the independent clinical review is also well underway, and further discussions are continuing early next week. We'll say more as soon as we can. As with the announcement of the inquiry, we'll ensure that former patients are informed directly wherever possible. But I would like to say to those who have suffered greatly at the hands of Professor El Jamel, we don't want them waiting a moment longer in order for the public inquiry to begin, and I can give them absolute confidence that there is a lot of work happening somewhat behind the scenes at the moment with the appropriate authorities, including the Lord President, to ensure that an appropriate inquiry chair is appointed.
Thank you. That concludes First Minister's questions. The next item of business is a member's business debate in the name of Ruth Maguire, and there will now be a short suspension to allow those leaving the chamber and public gallery to do so.